Good evening and welcome to another webinar of Ryonex Biomedical Ltd. Directly from the studio in the Sauerland Pyramids. Yes, we are already at the fourth and last webinar of our webinar series. Yes, welcome again also from my side. I'm glad that you are back with us. That's the last webinar of the series, is the fourth and the last webinar. And as I already told you at the very beginning, we will address your questions, but we also have some tips and tricks for you. Exactly, because we also received additional questions related to other areas and possible applications of bioresonance, according to Paul Schmidt, which also had to do with respiratory diseases. So I found this focus quite interesting, and we will also address it here. But before we start, it is important to point out, as in every webinar, that the many tips and advice we give you in this webinar cannot replace a visit to a naturopath or a naturopathic doctor. Furthermore, please note that conventional medicine has neither accepted nor acknowledged the effects of bioenergetic vibrations despite all the available studies. But we know there's quite a long way to go here, and studies such as the ones we presented, of course, help us to further establish it within the medical sphere. So, Mrs. Bunkenburg, let's come to the first point. We were asked what further possibilities there are also in terms of own secretions. Yes, I would like to elaborate a little on the subject. We have so many possibilities. We have the RAH programs. We mentioned them and explained how you can put them together, but we also have much simpler possibilities to help with respiratory infections. For instance, the use of own secretions. You can use nasal secretion, sputum, or saliva to support someone energetically. I'm sure that you all know how it works. You simply take a container, preferably a glass container, because it doesn't contain plastics. And has more purity. So you can take a handkerchief or a breathing mask, which is quite topical, as many people have recently worn them. That's quite useful, as they collect everything someone has breathed in, so it's very useful. But also remember that we have a lot of supporters of the autologous urine treatment, including pathogens that we may not even have in our system, and they can be found in the urine, and it can desensitize and support energetically with own secretions. Exactly, I'd like to add, and that's why I thought the question was great, that you can really support your entire system by treating it with own secretions. The next subject was the optimal equipment, green card and home therapy. What I liked about the questions that came in was that users, especially therapists, are now saying that it has slowly become established with them. It's a very long way. We have been doing and offering this for over 10 years now, but it takes time until something like this is actually integrated and established. So would you like to present it again? Yes, I think especially with respiratory infections, we have to realize that especially with chronic processes, it just takes time for the organism to react. And then it is difficult to bring patients back to the practice again and again for therapy. In the past, we said, okay, we could do therapy once a week, but if you do it twice, you will have a faster, better effect. But many people can't do that, and that's why this home therapy has become so interesting. Thanks to it, you can really support chronic processes over a long period of time. This means that the therapist sets up a therapy program, stores it on the card, gives the card to the patient, who then receives the basic and a detector and can integrate the treatment into his or her everyday life. So they can do therapy whenever it fits. We don't want to demand that it has to be done in the afternoon or in the morning. No, it simply can be done according to the patient's preferences. Many people also sleep while doing their therapy. This has become more and more common. Therefore, once again, we recommend that home therapy should definitely be included in the entire therapy concept. Exactly. Yes, with regards to the possibilities, it was also said that we have many programs that you can use. We have the 70s program for the respiratory tract, the upper respiratory tract, the lung system, influenza. The programs can also be integrated into the structure, as we will see when speaking about the compact programs. In this case, the 10-minute harmonization is sufficient. But if you want to use it for harmonization individually, then please give it a little more time, like 20 minutes, because there are many spectra and it takes time for the body to react. Yes, and that brings us to one of my favorite topics, the test protocols. Yes, the reason is quite simple. We also see it at international level. When you ask a therapist, and then you say, okay, we now have a RAH, an expert system, which we offer you with over 2,500 different programs. And we now have an indication such as bronchial asthma. And we ask, okay, which programs are important for you? Which ones would you like to test? Then the answers are often very rudimentary, of course. Not everyone is an expert in every field. And this is exactly the great benefit of the test protocols, because experts in these fields have compiled the test protocols, which sometimes contain more than 100 programs, which are compiled and have a reference to this indication. This means that by using these test protocols, you can leverage expert knowledge and, for example, select a test protocol, such as for bronchial asthma, and you just do the whole test and will have an energetic overview of deficiencies. That is an invaluable advantage, by the way, if I may say so. Some people afterwards also use the test protocols for harmonization. They select them and just execute them. But as I said, it's an expert compilation of RAH programs for the respective areas, and therefore it's an absolutely great opportunity. And of course, we also have programs for respiratory diseases. Yes, let's continue with the compact programs. These are the smaller, more concise programs that we have tailored to the diseases, and we can now really say that it has proven to be successful. In the webinar with Mrs. Phillip, we heard about it. As she said, you could add something to it if you really want to, but it is not necessary. With each compact program, we have a very, very nice sequence of programs that definitely supports energetically and are very helpful. So there are also chronic and acute programs. For example, you can select a cough or you can select a cold, for example. What else do we have? Now we have so many possibilities in the system. Schistler salts, it's hard to imagine life without them. Many people work with them, and the following question came up. Does it make sense to work with them and to check what could fit or work there? Yes, of course. Here you see the number 3, for example. It is for fever and inflammation in the early stage. We have structured it in such a way that you can simply look it up and apply it in the following order: first, second, third stage, which would be number 6 as a detoxification remedy. Just look it up, test it, and use the possibility. Exactly. In particular, these testings. So all Schistler salts are included in the RAH expert system, and accordingly, it can be tested whether they are needed or not. So, yes, that's all when it comes to Schistler salt. It's interesting that those questions about Schistler salts came up from the user community related to this area. That shows they are actually used. Wait and drink tea. That's very important in a way. And we want to speak about stress and stress reduction. We would really like to recommend this to everyone, and we have already mentioned it in other webinars. Stress is a common cause for the inner balance not being as it should be, and then the immune system suffers, and so on. What we would like to stress and what we would like to recommend is this program because it's also used very often. And of course, we were asked if you can use cough. Yes, of course. Cough helps with respiratory infections, and then you can add it individually to your system. You can test individual herbs. So with the BaPS, here we have a list of recommendations. Anise, eucalyptus, fennel. These are all herbs with which we can give additional support. And with our system, you have the possibilities of blending and measuring your ideal tea from these herbs. I think it's fun, but it's also really to the point, and we would like to recommend it again. So I'm sure some viewers will say, please don't continue yet. I would like to take notes. So I would like to point out that this webinar from this webinar series will also be available on YouTube. So you will have the opportunity to access this slide again and to read the information. So now we have more. Yes. Well, I think when we talk about respiratory infections, we also have to talk about inhalation. We have already mentioned that inhalation of humid air is, of course, very helpful for coughs and colds, and you can simply test it on an individual basis. And there are essential oils. Not all essential oils are tolerated by everyone, but with our system, we again have this individual possibility of adapting it to your needs. The same applies to full baths, sure. Yes. Again, this is also a great opportunity to have humid air. I can relax, which is always conducive to feeling better. The mucous membranes regenerate more quickly. I can enrich it with aerosol to further boost the detoxification process in combination, again, with oils and herbs put together individually via bioresonance according to Paul Schmidt. Exactly. And if you combine this with this full bath with a massage glove, that's just awesome, really good. Well, there were questions that did not necessarily have to do with what we had presented. So let's now take a look at the questions that came up. We will now simply go through them and answer them. So the first question I have is, I have been suffering from asthma for a long time. Can BaPS help me with this, or can it only worsen such as an attack? Well, we have already heard a lot about this in the past presentations, and we can definitely support energetically. It is a very gentle system, which means that the necessary basic frequency values and spectra are offered and can also be used in case they are needed. And our experience is that we definitely had no feedback of a possible aggravation or an increased number of attacks. So I would definitely give it thumbs up. It can be well used for this. Now, a very typical question that does not only refer to zinc, but zinc was mentioned because we emphasized it in the webinar. We spoke about the need for zinc and its relation to over 200 metabolic processes. The question was, is it enough if I treat a zinc deficiency with the RAH zinc program? That is not enough. It falls into the area of micronutrients in general, and we have these RAH programs preferably for testing. This means that we can see whether there is a deficit in these areas, and from this we can then decide to supplement zinc, for example. Of course, we have repeatedly been able to observe that the RAH programs also improve metabolic processes in the body. We've seen it in our 40 years of experience, but the very clear recommendation is to supplement the micronutrients. Third question. if the RAH shows a disorder in the enzymes, does that mean that I have an enzyme deficiency? Yes, especially in the case of enzymes, the answer is yes in 90% of all cases. For example, we have already tested many series with the RioScan, where we now have many empirical values. We wanted to verify what the results are when it comes to micronutrients. Is it a deficiency or a excess of micronutrients? There are very rare exceptions. For example, if someone already takes magnesium because he is an athlete, for example, then it can, of course, happen that we will have too much. But normally it's a lack of micronutrients and we need to replenish them. Is the product RioBase sufficient to make up for my zinc deficiency? That's a very good question. Of course, it always depends on which phase you are in. Whether you are in an initial phase of illness or in any other phase of illness, or maybe just in a phase of your life with an increased zinc requirement. The recommendations are always, and also in the case of RioBase, that in a homeostasis, the zinc or the zinc requirement can be nicely balanced out and you can keep the required level. But if we have higher needs of a micronutrient such as zinc, then of course we will have to supplement additionally in such a phase. Yes, exactly, then it's not enough and we have to do more. We have to supplement. Okay. If Rionex products appear in the scan measurement, does that mean that the patient needs the product? Yes, that's a bit similar to what we had before. It is indeed the case that there are deficits that can be covered by the products. And it's also quite helpful in interpreting the findings. So if a Rayoflora has a high percentage weight in the findings, then one can say that Rayoflora is needed. But of course, I can also draw conclusions. If the Rayoflora is needed, one can assume that there are not enough probiotic bacteria, that perhaps there is a problem in the intestine. It helps you with interpretation. But in any case, it is advisable to use the product, yes. Exactly, and this is also a special feature because we have also developed a RAH program for the entire product in order to facilitate the decision that such a product is actually needed, just as you have said. Yes, the sixth question. Is the mini Rionex 5G enough to protect me from electrosmog? Well, the mini Rionex was, so to speak, the original mini Rionex, which has been around for almost 40 years now. It was the original invention of Paul Schmidt. Over the years, it has undergone many small changes, small improvements and optimizations, both in color and shape, but also with the dipole antenna system and, of course, with the frequency spectrum that we have offered. And from the mini Rionex, which classically aims at fundamentally increasing the cell activity, which is very important for every disease and every stress that affects me. So from this and in a further step, the mini Rionex 5G was developed. That is a mini Rionex plus the 5G frequencies that have a particularly negative effect in the body. So this is what the mini Rionex 5G contains. When we are traveling, of course, we take it with us because it's just a nice combination of the mini Rionex and the 5G. But it does not cover the complete frequency spectrum, which is triggered by pulse modulation in the organism. And therefore, of course, the recommendation is that the mini or the mini Rionex 5G is a bioresonance device to go. to take it along when you're on the road, when you're in the car. It's important to use it when you're elsewhere because you don't know the conditions around you, especially in hotels and so on. And for this, it is the perfect solution. At home, when you really need to regenerate and balance yourself, the duplex in combination with the rayonators is, of course, the measure of all things. That's what I would say. There are various combinations, for example, duplex and 5G rayonnator, but also, for example, the e-smog rayonnator and the AHF rayonnator, which specifically refers to pulse modulation. Okay, 7th question. Which is better, the stationary solution or the mobile solution for e-smog? Well, I had already anticipated it when answering the 6th question. I think it has become clear. The combination of both makes the most sense. Yes, and now to the 8th question. Does the duplex for professional have a longer range than the normal duplex? No, because the base and also the dipole antenna system are the same in both devices. With the duplex for professional, however, we have the solution of adding individual basic frequency values to this device and thus finding a completely individual duplex for your home or, for example, for your workplace. And the basic frequency values of the individual persons, but also of the animals living there are tested. They are compiled, and you can input them into the for professional, and thus meeting the needs of this household and the humans and animals that live there in a customized way. But the range of duplex for professional is the same or is not greater than that of the normal. There would be no reason for it. Can I test myself with the M8 module is the next question. Well, the module 8 is not meant for testing. That means that in module 8 we have quite a large number of compact programs that are used quite frequently, like coughs, colds, etc. I always say that it's like the first aid kit for humans, but also for animals, for example, also for horses, dogs, and cats. But we have designed it in a way that you can treat yourself directly with these compact programs and that you don't have to go and test. Exactly. Model M8 is our entry module into the world of bioresonance, according to PulseMed. Anyone who finds the system great, has heard many good things, and says, yes, I want to get started, can of course decide to get a Radiocom PS10 Lite, which then includes the M8 module, and knowing that the device can grow with the increasing demands. So it's easily possible to upgrade the M8 module to a M9 in order to have complete access to the therapy programs, for example, or to the M10 module in order to have all the RAH programs and to be able to test them and so on. So that's really a nice start. In case of a cold, what should I use to run it along? The nasal secretion or the sputum? Well, running along, I would like to explain that again for everyone. We have already explained it in the case of your own secretions, that you take them, you place them in the protective cup, then start a program, and then you carry out your therapy and harmonization. And this running along refers to the spectrum that I have added to this cup, for example, with the sputum or the nasal secretions, as mentioned in the question. The question of which is better has no clear answer. Quite honestly, if you have several options, then simply use these options and put everything in the cup, because it is simply a matter of harmonizing the frequency spectra that are present in the secretion or sputum, and it is like an add-on to the program. Yes, and technically it works perfectly because the transfer values are set in the device. So I can simply add the nasal secretion to the RAH programs that are running. And as you said, it's an additional program which is customized because it's actually something from your own body, which is good. So next up, which RAH module can I use to access the test protocols? Talking about test protocols, we always have the 10 module in mind. So we really limited it to the largest, most comprehensive module. That means that if you have activated the module 10, then you have access to the test protocol. Of course, if you work with a polar, you have it in RAH vet and also in human, and you have the possibility to access test protocols. Okay, now we have a very tricky question, but at the same time a very good question. It needs to be explained, and it just shows that people are really reflecting on it. Can I add other programs to the compact programs? With the compact programs, if you enter the number, you access the compact program and then you run them. It's a question of how you want to do it. Mrs. Phillip already mentioned it in her webinar. For example, she attached the enzyme programs. So that's a possibility. But in the Rayocom PS 1000 Polar, where I have the possibility to add further programs if I have them in the memory. Yes, that's right. But I also find question 12 concerning the compact program so great because there is definitely something we still have to explain, which is the topic of compact programs and M8 module. Because if I have the M8 module, as for example in the Rayocom PS10 Lite, then I can indeed only access the compact programs and cannot make any additions to them. That's something I can only do in higher modules, but I can always upgrade them. It should also be noted that the compact programs, due to the increased number of users and their popularity, they have a new user interface, which is much easier. And now in the Rayocom PS10, I can simply press a key. I can simply press the IF1 key and then immediately type in the compact program number. Then I don't have to go through various other ways to get to the respective application program. So press IF1, type in the number, start, and off you go. But you need to update it. Correct, it is included in the latest software update. Otherwise, you can't do it. Yes, that's right. Anyway, it is free of charge like all our updates so far, which is also a big novelty, I'd say. We want to make sure that everyone can actually use the latest possibilities in order to be able to better help. Yes, and now to the last question. When I have activated module 10 on my PS10, do I automatically have module 8 on my device? Well, that's the question. Do you have it or not? We receive that question very often. I think it's because module 8 is still very new. It's also very special because, well, it has human compact programs and vet programs. And the answer is yes, you have it. When you have a new update, which is necessary, otherwise it doesn't work. And if you have module 10, you automatically have the new module 8. And then you also have the programs for animals in the human area. Yes, that was important to us. For the very first time in the history of Rayonex Biomedical, it is like that. We said, if I have module 11, for example, and I'm working in the veterinary field, then I will also have module M8 in it, and thus also have the possibility to do something in the human field by using the compact programs and the other way around. If I have the M10 module, I can also do something in the veterinary field by accessing the M8 module and the compact programs. A lot of people are really happy about it and really find their way into the other area of application because a lot of people have animals, they have pets, and they love it, and they enter at a more professional level when it comes to the M11 module. So thank you very much again. It was great. We hope that we will constantly take another step forward in the application, in the acceptance, and of course in the possibility of gently helping as many people and animals as possible with bioresonance according to Paul Schmidt. Take care. See you. Stay healthy. Thank you. Bye-bye.